we had observed in our laboratory that that signaling through the gamma interferon receptor was very important for alloreactivity of donor T cells in a mouse model of graft-versus-host disease. And we also showed subsequently that the IL-6 receptor is very important as well. And both receptors signal through JAK-STAT signaling pathways. And there was already developed for the treatment of myeloproliferative diseases, myelofibrosis, a drug called Jakafi, which is used to inhibit JAK-STAT signaling, JAK1, JAK2 in myeloproliferative diseases, specifically myelofibrosis. And so we just initially tested that pathway by deleting genetically a number of the components of both the gamma interferon and IL-6 signaling pathway, and then used pharmacologic inhibition with JAK inhibitors to show that both were equally effective at blocking graft-versus-host disease. So we extended that as others did in the clinic, and a number of companies, and specifically Incyte before most of the other companies, extended this into clinical trials, into phase 1, 2, and 3 clinical trials with very related JAK inhibitors. And so we did a phase 1 study with a JAK inhibitor called Itacitinib, which is mostly JAK1 specific, and showed that the response rate in steroid-refractory graft-versus-host disease was about 60%, which we felt was very consistent with retrospective analyses with Jakafi, the early phase studies with Jakafi, and the subsequent studies with Jakafi and in both phase 2 and randomized phase 3 settings. And so we think that this drug, Itacitinib, would be a suitable substitute for Jakafi, which has the, in theory, downside of causing some decreased signaling through the cytokine receptor pathways. And so the worry was that that would cause more cytopenias, in particular thrombocytopenia, than Itacitinib, which is more JAK1 specific. So I can't tell you if that's the case, but I can tell you that both work to reduce graft-versus-host disease when given either prophylactically or preemptively in mouse models of GvHD. And now Itacitinib, in a phase 1 study that we did, demonstrated a response in patients with steroid-refractory graft-versus-host disease, which was gratifying and similar to the response that was seen in these same kinds of patients treated with Jakafi. And so these preclinical studies and the early clinical studies have resulted in now recent publication of a phase 3 phase 3 randomized trial, which was recently published in the New England Journal, confirming the role of Jakafi as a JAK inhibitor, which reduces or effectively treats steroid-refractory graft-versus-host disease. And now these JAK inhibitors, Itacitinib and ruxolitinib, which is Jakafi, and baricitinib, are all being tested, as well as a number of other JAK inhibitors in the context of either treating or preventing graft-versus-host disease.